Tonight we are tracking a measles comeback that doctors say did not have to happen. Here in Washington, 6 people have gotten sick this month alone, most of them in Snohomish County, with the latest exposures traced to a church service. Nationwide, health officials report measles cases are climbing again. The CDC confirming hundreds of cases this year across 14 states, including more than 600 cases in South Carolina alone since the start of this year. All of this unfolding under the leadership of Health and Human Services Secretary Robert F. Kennedy Jr. and his mixed messages coming from Washington, D.C. Joining us now live to discuss is Dr. Vin Gupta, pulmonologist and NBC News medical analyst. Dr. Gupta, thanks for joining us tonight.
Good evening, Joyce. Good to be with you.
Okay, so right off the bat, we have these 6 confirmed cases of measles in Snohomish County just this month. What are your concerns about that?
Well, measles, we know, Joyce, in places just north of Seattle, but across the country, really tends to run and cause very significant outbreaks that can disrupt a child's in-person school learning, can disrupt communities and their well-being. It can overwhelm children's hospitals across the country. And what we're seeing is zip codes that have less than 60% vaccine uptake rates for the measles vaccine, which means that those zip codes, those communities, are incredibly vulnerable to measles outbreaks because this virus is incredibly contagious. One person can infect 10 people around them, especially if those individuals are also unvaccinated. So this is a very serious situation because we haven't really had this level of vulnerability, Joyce, in the country, and certainly in specific communities like South Carolina. We're seeing 800 cases just over the last few months. We have never really seen this in our lifetimes before. So this is breaking new ground.
I think people probably don't understand, too, the long-term health impact or what can happen if someone gets measles because it's so contagious and they haven't been vaccinated. So what are the risks? Why should people be concerned?
Let's go through the symptoms, and it can be really confusing. Right now, we're in cold and flu season. Unfortunately, measles is a great mimicker. It can cause classically cough, coryza, conjunctivitis. What is that? Well, cough is cough, coryza, a runny nose, conjunctivitis, pink eye. Those could be the sentinel symptoms, Joyce, after exposure for the first few days before going to that classic rash that starts at the face and then travels down to the trunk. That's what parents need to be on the lookout for. If your child develops upper respiratory symptoms, pink eye, runny nose, don't immediately assume this is just going to go away, especially if you've been hearing about measles cases in and around your community, in your child's school. This is something to take seriously and to make sure you see your child's pediatrician to get tested. But what's the bigger concern, too, for that specific child, whether they're in Snohomish County or South Carolina, is about 1 in 5 children develop severe pneumonia from measles. So this is not something that causes self-limited upper respiratory symptoms. It's not something that just causes a rash. I think that's the confusion. It can actually cause severe pneumonia, Joyce, leading children to go into the hospital. And that's what we saw in West Texas earlier in 2025. Children's hospitals overwhelmed because of measles-related pneumonia. And I think that takes parents by surprise.
As you know, in South Carolina, we're seeing the largest measles outbreak since it was declared eliminated. And we've seen spiking cases in Texas. There's cases all across the country, I think at least 14 states. Well, how did we get here exactly?
Unfortunately, you and I have had this conversation now for about 12 months under this new leadership and regime of Robert F. Kennedy Jr. It's not hard to draw a direct line between how they speak or do not speak about the importance of vaccination and these declining vaccine rates. I mean, it is that simple. Decreased confidence, increased questioning about safety coming from him and his administration has resulted in a lot more burden on parents to ask questions of their pediatricians, not like there's already plenty to do in that 15-minute child visit. Here we are adding greater confusion and asking more questions that, frankly, I don't think need to be asked. This is no new science here, Joyce, has unearthed itself in the last 12 months about the safety or the efficacy of this vaccine. This is self-created.
I want to switch gears. Forgive my voice. Indian authorities are investigating the Nipah virus outbreak there after 2 confirmed cases. What concerns do you have about this deadly virus spreading?
Well, I think first, this is probably an unusual sounding virus to many of our viewers. And so it's important to just say this is not something that we're worried about causing, say, a coronavirus like pandemic. Is it serious? Yes, it's serious. Is it limited in terms of its ability to cause an outbreak or something that can cause a global pandemic? Absolutely. We're not worried about it being as contagious as, for example, measles or, frankly, coronavirus. But it's something to take seriously. This is yet another example of an infection that can jump from a bat, in this case, or an animal, in this case, a fruit bat is a common vector, to human. And now we're seeing even cases, Joyce, of human to human transmission that are limited, and one human transmitting it to another human, not to 10 other humans. So this and it has a very high mortality rate, as you pointed out in the tee up. This is something to take very seriously if you visited a country where Nipah virus is common. And so southern India, parts of Southeast Asia, where this is endemic, and this is something that potentially, if you present with respiratory symptoms, a headache, this can escalate quickly. There are not great therapies, and that's the concern. This is yet another example of an infection traveling from animal to human, and then from human to human. And when we think about this world of avian flu and other infections that can do something similar, this is the world that we live in. And so whether it's Nipah virus or whether it's just what Nipah virus is showing what's possible, we are in a very different world now over the last, especially 5 years, where the threats to our health are multimodal.
Dr. Gupta, thank you so much for your time tonight. We really appreciate it.
Thank you, Joyce.